Welcome, ladies and gentlemen, to today's tutorial. Today we are going to look at muscles of mastication, muscles that are going to be relevant in chewing. Now, these muscles are going to work on the temporal mandibular joint to produce various movements which are going to be relevant in chewing of food. Now, these movements will include, of course, protraction, retraction, of course, elevation against gravity, and of course, depression. Now, all these movements, as I indicated, will happen, at the temporal mandibular joint. Now, these muscles actually arise from the first pharyngeal arch or the first bronchial arch, and therefore will be supplied by nerve to the first bronchial arch. And this nerve is the mandibular nerve, which is the third division of the trigeminal nerve, the cranial nerve 5. Now, these muscles, will include what we call the temporalis muscle, and of course, the temporal muscle will be found in the temporal fossa. Therefore, I also explain, those boundaries and other contents in the temporal fossa. Then we also have what we call the medial and lateral thyroid muscles, which are going to be found below the temporal fossa, which we call the infratemporal fossa. Therefore, I also talk briefly on the infratemporal fossa as well. And of course, we will end with actually the master muscle. The master muscle. So without further ado, let's begin our journey looking at muscles of mastication. So here we are. This is one of those muscles, which we call it the temporalis muscle. This temporalis muscle will lie in what we call the temporal fossa. Now, this temporal fossa actually will be superiorly will be bounded by what we call the superior nuchal line. So if you visit the osteology of the skull, you get to know that this is the superior nuchal line, where actually the fascia of the temporalis muscle actually attaches to the superior nuchal line, forming the superior boundary of this fossa over here, which we call temporal fossa. Again, anteriorly, it will be bounded by actually what we call the frontal process. This bone over here is the frontal process, because it's going to articulate with the frontal process of the zygomatic bone. Frontal process of the zygomatic bone will bound it, actually anteriorly. Then, of course, with the inferior aspect, it's going to be inferiorly. You have what we call the zygomatic arch. Zygomatic arch. Then, of course, you know that the zygomatic arch, majority of it will be contributed, by the temporal, the zygomatic, process of the temporal bone, with small contribution coming from actually the temporal process of the zygomatic bone. So this is the zygomatic arch. But of course, this temporal fossa will communicate inferiorly with what we call the infratemporal fossa. So that is what we are going to find regarding the boundaries. Now, by way of content, we are going to find, of course, we've seen the temporalis muscle will be there. Apart from the temporalis muscle, we have also what we call the deep, temporal nerves and vessels. The neurovasculature of the deep temporal, structures will be there. Then we also have what we call the auriculotemporal nerve will also be present there, because what happens is that here is the ear. Here is the ear, and this temporalis muscle is actually, or the temporal fossa, is actually superior, anterior superior to what we call the ear. So anterior superior to the ear, external ear, actually, we are going to find what we call the temporal fossa as well as the temporalis muscle. So therefore, we will also talk about the auriculotemporal, nerve will also be there. Then of course, we also have the superficial, temporal vessels will also be there. So these represent actually the content of the temporal fossa. Now, importantly, because we are talking about muscles of mastication, this muscle is of importance to us. This fan-shaped muscle is the temporalis muscle. Now, this temporalis muscle will actually originate, from the fossa, the temporal fossa, and then it will run, inferiorly, inferiorly. Of course, in the temporal fossa, you know that we are going to find it below, it will actually find attachment to what we call the infratemporal line. Therefore, it will be found below the, superior temporal, line. So actually in the temporal fossa, and then it will run, inferiorly. It will run inferiorly, but deep to what we call the zygomatic arch, okay, zygomatic arch, to actually insert onto what we call the crinoid process, okay, which is found in the remorse. This is the remorse of the mandible. This is the crinoid process. So it will insert on the crinoid process of the remorse of the mandible. So you can see that's how the muscle, inserts. Now this muscle, what happens is that I'm going to divide it, actually into two. Assuming I divide it this way, then you are going to have the anterior fibers. Then we also have the posterior fibers. Now the anterior fibers will actually be relevant, as far as elevation. Okay, it will help elevate. So moving the mandible against gravity, actually to help close the mouth. Okay, to help elevate, the mandible, okay, against gravity. So that's the kind case. So you can see that's the anterior fibers. Now for the posterior fibers, they will be important in retraction. Okay, pulling the temporomandibular joint posteriorly, retraction. Okay, so that's what actually, well, in any case, yes, although it's not really the main function of it, but it can contribute towards your side to side movement, okay, at the temporomandibular joint. Of course, we said that it's going to arise from the first pharyngeal arch and therefore be supplied by the mandibular nerve, but actually it's going to be the deep temporal branch. It will give the deep temporal branch of the mandibular nerve, actually will supply it. So that is the temporalis muscle, which lies in actually the temporal fossa. Now, the next two muscles that we're going to talk about them, yes, they are usually out of sight, but what happens is that they find themselves, actually around this area, which is actually found below. Okay, here we are going to have, yes, this is the anterior cranial fossa. This is the middle cranial fossa, and of course the posterior cranial. So at the middle cranial fossa, inferiorly, we are going to find that one. Okay, we are going to find what we call the infratemporal fossa, and it will actually be located, between the pharynx, which we've seen, okay, pharynx around the throat, and of course the remorse of the mandible. So that's where we are going to find it. Okay, this is the remorse of the mandible. So we are going to find this fossa over here, remorse of the mandible, as well as of course the pharynx. The space over here, okay, the fossa over here is the infratemporal fossa because it's below the temporal fossa. Now, anteriorly, this fossa will be bounded by body of the maxilla. Okay, here is the maxilla. So the body of the maxilla will bound it actually anteriorly. So this is the maxilla. So that's the body of the maxilla. Okay, so actually the posterior surface of the body of the maxilla will will communicate with it, anteriorly. And then posteriorly, it will be related to what we call the styloid process of the temporal bone, styloid process, the pen-like process, of the temporal bone. It will relate to it. Styloid process of this is actually the mastoid process. So anterior to it, okay, will be the mastoid process. We relate to it actually, posteriorly, as well as of course, the carotid sheaths, because this is the area where we are going to find, of course, the carotid, triangle actually. Then even apart from that, we are going to find the common carotid as well as its divisions. So the carotid sheath will also be related to it actually posteriorly. So styloid process and carotid sheath posteriorly. Then of course medially, they will be related to what we call the lateral pterygoid plates. So here we are. This is the sphenoid bone, the sphenoid. Now if you take the sphenoid, what we find is that we are going to find the lateral pterygoid. This is the medial pterygoid plates, processes together forming the plates. So we are interested in the lateral pterygoid, okay, so that this fossa will be related to the lateral pterygoid medially. Okay, so here is it, the medial portion. So the fossa, okay, over here will be related medially to what we call the lateral pterygoid plate. Then of course laterally, it will be related to, of course, the remorse of the mandible. Okay, so this is the remorse of the mandible, which will relate to it, actually laterally. Okay, so remorse of mandible will relate to it laterally. Alright, so that is what usually we are going to see regarding the boundaries of this infratemporal fossa, where we are going to find the lateral and medial pterygoid muscles. But in addition, we also find what we call the inferior part of the temporalis muscle. Okay, so there's the temporalis muscle also finding itself, the inferior portion also finding itself in the infratemporal fossa. But in addition, we're also going to have what we call the mandibular nerve, yes, together with its branches, the chorda, tympanic nerve, the optic ganglion. Then of course, we're also going to have what we call the pterygoid plexus of veins. Then in addition, we also have the maxillary division. Okay, so here we are going to find what we call the maxillary division. Okay, there's this blood vessel over here, which is actually branch of the external carotid artery. So the maxillary branch of the external carotid together with its branches will also be a content of the infratemporal fossa. So here we are. So mainly we are interested in what we call the pterygoid muscles. Now for the lateral pterygoid muscle, it's going to have two heads. It's going to have an upper head and a lower or superior and inferior head. Then of course it's going to originate from actually the upper portion or the superior portion of the head of the infratemporal surface, actually around that area. Okay, so infratemporal surface, okay, over there, that's where it's going to originate. This is where actually we are going to have what we call the upper head actually originating from the infratemporal surface over here, as well as of course the crest of greater wind of sphenoid. Now if you want to see the greater wind of sphenoid, okay, so let me show it here. So here we are. This is the greater wind of sphenoid. So its crests, okay, will provide that kind of origin from the superior head. Then of course for the inferior head will actually originate from the lateral pterygoid plates. So lateral pterygoid plates will also provide that kind of in fact the lateral aspect of the lateral pterygoid plates will provide origin for the inferior head. So while of course the superior head is getting origin from the infratemporal surface, okay, as well as the crest of the greater ring of sphenoid, the lower head is actually getting its origin from the lateral aspect of the lateral pterygoid plate. Now together they will insert around the neck as well as the capsule of the temporomandibular joint. So this is where the lateral pterygoid muscle will insert. Okay, so this lateral pterygoid muscle will actually, yes, we said that it's going to be supplied by actually the mandibular nerve, but actually the anterior division of the mandibular nerve, and then its action mainly will be for side-to-side movement. Again, it will also be responsible for depression, and then of course mainly for chewing, as all these muscles are going to do. So that is that muscle, the lateral pterygoid muscle. Now for the medial pterygoid muscle, unlike the lateral pterygoid having upper and lower, this one will have deep and superficial heads. Okay, so it's going to have two origins. The deep head will come from the medial aspect. Okay, so this time around from the medial aspect, okay, the deep head of the medial pterygoid will be coming from the medial aspect, okay, of the lateral pterygoid plate, okay, of the lateral pterygoid plate. And then of course we also have the inferior the superficial head also coming from what we call the tuberosity. Okay, the tuberosity, okay, over here, this represents the tuberosity of the maxilla, as well as of course the palatine bone. Okay, so this represents the tuberosity of the maxilla, as well as the palatine bone will have origin from this area, and then they will actually come together to actually insert on what we call the remorse of the mandible, okay, remorse of the mandible, as well as its angle. So the muscle that you can see here, over here, okay, inserting on the remorse of the mandible as well as the angle of the mandible is known as the medial pterygoid muscle. Now this medial pterygoid muscle, of course, will be supplied by the mandibular nerve, will actually be important in elevation of the mandible, okay, at the temporomandibular joint, in side-to-side movement together with that of the lateral pterygoid. Then it will also be important in protraction, okay, protraction of the mandible, okay. That is what it's going to do. So these are the pterygoid muscles, which are not very clear over here. You can see only the medial, the insertion point of the medial pterygoid, okay. Lateral pterygoid is out of sight. Now the next muscle which we are going to look at is known as the masseter muscle. The masseter muscle, okay, this is the masseter muscle. Now this masseter muscle is actually having three fibers, superficial, middle or intermediate, and of course the deep fibers. Now it is going to originate, actually from the zygomatic arch, okay. This is the zygomatic arch. So this is where it's going to originate from, the zygomatic arch, and then it will run and insert on, of course, the remorse of the mandible as well as the angle of the mandible. So remorse as well as the angle of the mandible. This nerve will be important as far as elevation, okay, of the mandible against gravity is concerned. It will also be relevant in protraction, and it will also contribute, mainly, yes, to protraction. Now this muscle, sometimes if someone gets to the advanced stage of tetanus, it results in there's going to be spasmic contractions, okay, tonic contractions of this muscle, and that leads to what we call lockjaw. So this is the muscle which we call it the masseter muscle, and it lies superficial to what we call the deep muscle, which we call the vaccinator muscle. Now these muscles are all skeletal muscles, and therefore they will be actually voluntary in action. So ladies and gentlemen, this was a quick tutorial actually looking at muscles of mastication. I hope it was helpful to you, and we will look at other things in our later sections. Thank you very much, and may God richly bless you.